Hi, good afternoon, and thank you for joining us here for another segment of Wildlife Wednesday. I'm Rachel, and today I'm going to be meeting Missy Fox, one of Crow's veterinarian technicians, down at the hospital to learn a little bit more about parasites. On today's Wildlife Wednesday, Missy's going to talk about the different types of parasites that are found on different species of wildlife, as well as how Crow identifies what type of parasite it is for us to treat.
Hi, I'm Missy. I'm the vet tech here at Crow, and today we're going to talk about parasites and what we find in wildlife. So when the animals come into us, they may have ectoparasites or endoparasites. So ectoparasites are the parasites found outside of the body. So for example, fleas on a pet or on a squirrel or on a raccoon, possums as well. And then we have endoparasites, which are the internal parasites, which may be tapeworm, roundworm. I don't know if anyone's ever had a pet that had parasites. You may see it in their feces. With our animals as well, they come in with parasites from the wild. So our most common parasites that we see here on mammals, fleas, of course ticks as well. Sometimes we get in rabbits that are laying on their side, not even moving, and a lot of times we think it may be trauma, but we find they have tick paralysis from all of the ticks that are all over their body. They also may have huge botfly larvae in their skin. The fly will lay their egg, and it looks like a huge bump and a little hole. And we can actually pull that huge larva out of there. And then they can heal from that if they do have botfly larvae. Another thing we see often with birds is feather lice. And a lot of people may watch our live video and see us wearing towels on our heads like this. And that is because we have bird lice on our skin. So they climb on the top of our head, they go to the highest point, and we wear our little lice hat, which they crawl onto that hat instead of being on us. And so they like to live on feathers, so they'll die, by the end of the day on a human. They also have flat flies, which a lot of people in rehab, if you see us on video running around a room, that's because there may be flat flies in there. So nobody in rehab likes flat flies because they fly off of the birds and fly right onto us and try to land on us as well. So a lot of those flies can cause blood parasites in the animals. So we don't necessarily like to have those land on us.
So Missy, what types of animals are presented with feather lice and flat flies? Is it all types of birds or just certain ones?
So all birds can have flat flies and feather lice, but mostly we find that any type of heron is really likely, especially the great egrets for some reason, are covered in flat flies. We don't know if they love the white feathers or what, but any white bird tends to have a lot of flat flies. And actually in the wild, if you see a great egret or a snowy egret, you can usually see the flat flies walking around on them. They look like little dark spots under their feathers that are moving.
And how about the feather lice?
So any bird can have feather lice. A lot of times we find a ton of our seabirds have it. If they're debilitated, the feather lice kind of proliferate when they're down. They're not preening and acting like a normal bird. So their feather lice kind of goes crazy. And it does chew blood. So not saying that that can cause a huge amount of anemia, but that is something we're also thinking about with the feather lice, that this bird has been debilitated for a while if they're covered in lice. So here at Crow, when the animals come in, we like to get a fecal on them and see what their parasite load is. If it's a tiny amount of parasites, it's pretty normal in a wild animal to have a small amount of parasites, but when they're debilitated, the parasites can go crazy inside of their body. So we do a fecal, and here's a little cheat sheet we have here with different parasites. So each bird can have different type of parasites, and there's ones that are more common between each species. So for example, this one up here, this is a fluke egg, and that's common in a raptor. So if we see a few of those, we are not necessarily going to treat that animal for that parasite. And if it's a very low burden, sometimes we don't even need to worry about that. But if we get a pelican in, for example, or another seabird that has a huge amount of roundworm, for example, which are these dark eggs here, then we have to treat them for that. So a lot of times we'll give them a few days to stabilize, because that is a traumatic event if they have a huge worm burden, for us to treat them for that. So we'll make sure that they're up and around and starting to eat on their own, and then we can treat them for the parasite. So
See, when you're treating birds for parasites, are you treating them for the ova, the egg, or the worm, or both?
So we're treating them for both. So a lot of times we'll only see the egg. On certain parasites like strongyle, which is a roundworm that opossums always have a lot of, they're actually larvated. And so they're actually swimming around in the slide when we look at them. So with our fecal, you don't need much to do a fecal. You need a microscope. And instead of using the expensive fecal containers, we actually use 1 ml and 3 ml syringe cases, which helps us conserve money that way. So they work really well. So for our fecals here, we just do a direct and a float. So most of our parasites these animals have can be seen that way. Other parasites, you can spin them down to see better, but the ones that we most commonly see just come right up with the fecal float. So I'm going to set up a direct here. So we've got saline or distilled water, and you just need a tiny amount of that feces. You don't want to see it. If you can see a bunch of feces on your direct, you have too much on there. So you can see the hawk barely has any here. And so this is going to be our direct. For our float, we use Fecasol, and we go ahead and add this to our syringe case. Stir it around, and I like to jokingly tell the students here to make poop soup, because basically that's what we're doing, is stirring it around. We want to make sure that we get the feces broken up so the eggs can float to the top for us. So I set it in our little holder here. Fill it up, make a meniscus so the eggs can float to the top, and stick to a cover slip. So we let that sit about 8 to 10 minutes. This guy here, the direct, I can just drop a cover slip directly onto these and go ahead and immediately read my directs.
So Missy, what would be the benefits between doing a direct versus a float?
So the float will actually bring more of the ova or eggs to the top. And so on the direct, you may see the live larvated strongyle moving around. And there's other eggs that you can see better with the float. And the float should bring up more of the eggs because of the salt in the float material. So I've got my fecal set up here, my direct, and I'm taking a look at it. And as you can see on our screen here, it's got quite a bit of debris. So the ova or eggs will be uniform in shape and size. So once you get to know what an actual ova looks like, you can look at a fecal pretty quickly, because they're not going to be different sizes. For example, this roundworm egg is not going to be a roundworm egg here. See how small that is? This is not the same as this. And they're always really round and perfect, like a normal, if you think of an egg. They're not going to be wobbly. So this is all just debris, which could be pollen. It could be the food he ate. And so you never know what some of the stuff is. But once you get to know what a fecal looks like and what the eggs look like, you will be really good at looking at it.
Hey Missy, how long did it take for you to get comfortable reading fecals?
Well, I mean, it takes a while. It probably took me like a month or two here to get to know exactly what the parasites commonly are with the animals. So in dog and cat, they're pretty similar, but being with dog and cats, they're less likely to have parasites because they're people's pets, which usually have been treated. So it's less frequent that you see it. But getting to see pretty much every wild animal has parasites, you get really good at doing fecals.
Thank you, Missy, for sharing all of that wonderful information with our audience today on parasites. And one final thing before we conclude our segment today is parasites and focusing on the treatment of them is not only important for Crow's wildlife patients, but also important for you as well. because unfortunately some of the types of parasites found out in the environment as well as in on our wildlife animals can not only affect them but also affect the health of the environment as well as humans. So Crow works diligently with different federal, state, and local agencies to evaluate the health of our wildlife to in turn help us as well. If you've enjoyed all of this information in today's segment, continue to support us every week and click on the donate button above. Have a good day.